In this video we're going to look at taping for anterior tibialis tendinopathy and even for anterior compartment syndrome. When patients present with pain around the anterior part of the shin, then commonly there's an area around here which I'll just mark with a sticker, and this is the tibialis anterior, and people can get like a tendinopathy of some sort, but also very commonly patients can get pain around the actual belly, and that's either an acute or a chronic anterior compartment syndrome. So kinesiology taping will help both these conditions. So what we've prepared a longer eye strip because we naturally need to cover the whole of a muscle, and we've actually prepared two smaller eye strips. So first of all, the tibialis anterior, where it goes to is the medial cuneiform when it first met. So we need to put on stretch. So that muscle is responsible for bringing the foot up and in. So we're going to stretch by pushing the foot down and out. So we put some stretch onto that muscle. First tape, split the first part and apply that towards the insertion. So that's going to come down to that part of that foot, like so. Now peel that back to the end. And what we're going to do is lay down the tape. So little to no stretch, just a little bit of stretch between 10 and 15%, and lay down and cover the actual tibialis anterior muscle. And I can just mold that down like so. So we've covered the whole of that lateral part of that tibia, so we are right up to that tibial condyle. So let's say, for instance, the pain is presenting around the anterior part of the joint, so around this area just here. Then what we can do is using the two eye strips to form an X, and then these will actually decompress the actual pain. So the first one, we're actually going to split the tape and peel that back. And peel that back, so to the end, and then when you get the ends, just literally hold it with your thumbs, and then 100% stretch, back off a little bit, but between 75 and 100 is fine. So directly where the pain is, we're going to cross, and then the ends stick down, and then let the end just mold out. And the same with this one, so split the center, peel one end back, peel the other end back, and then turn it over. So we got in that position, and then 100% back off a little bit, cross the area of pain, and then stick down the ends with no stretch. Use the back of the tape, and then heat activate the glue just for a few seconds. If we have pain further up, we can apply the X further up here. So that would be kinesiology taping for any form of anterior shin pain.